Okay, so to walk through the pipeline, what's currently being developed, and there's a variety of different agents that we're looking at, and they're at various stages. So Dr. Torkelson had reviewed what phase 1, phase 2, and phase 3 meant in the drug development process. But just to remind everyone, phase 2 is what we call proof of principle. This is when we're using it really for the first time within dry eye patients. And we're looking to see, how does it work? You know, where does it affect the patient? Is it affecting the staining of the surface of the eye? Is it affecting their tear film stability? How does it work? Once we go through phase 2, then we get into what's called phase 3, and that's really the final stage before the agent gets approved. And it's at stage 3 that we have to show the effect that we saw, that it is reproducible, that if we do it in 2 independent trials, that's sufficient for the FDA to say, yes, we will approve this agent. In the area of dry eye, what the FDA requires is they want to see efficacy, or they want to see the drug work in one symptom as well as one sign. Okay, so that could be the sensation of burning, and it could be the presence of this corneal staining that we've been discussing. Those are the standards that's what we're working with today. So as we go through the list, you'll see that some are in stage 3 or phase 3, others are in phase 2. What's interesting too, over the past 15 years, we've seen some significant advancements in how dry eye therapies are being delivered to the eye. It's not only just an eye drop. In fact, we're seeing some very novel approaches where there's different technologies like iontophoresis, which I'll talk about in just a moment, but it's using electrical charge to deliver medication to the eye. We're seeing things like oral treatments for dry eye, so that would be very similar to as we deliver flaxseed and the omega-3s to our systems. Also, we're looking at intravenous treatment for dry eye. That's one of the latest trials that we've completed here at Aura. It may sound extreme, but in extreme cases requires extreme measures. So sometimes using something like an intravenous to deliver medication to yourself to really help with a severe case of dry eye would be beneficial. And then some other cases where we've done what's called a subconjunctival injection, so a needle that places a little depot of medication into the eye. And all these methods are really intending to hope that we're lengthening the duration of action of that medication, that it's staying in the eye and it's going to really have an effect. Okay.